This is my contact lens insertion and removal video. So before we do anything, we of course have to wash our hands. This prevents a good hand washing routine prevents any bacteria to be introduced to your eye that does not need to be there, which can negatively impact your vision. So after we've washed our hands, then prior to inserting the lens, we have to rinse it. This gets rid of any preservatives that the contact lens may have. So we can use Biotrue. Biotrue is a very good multi-purpose solution. It can help us in rinsing and disinfecting, anything like that. So the way that we rinse or clean a contact lens is by putting it at the palm of your hand. Do not rub it because this can scratch the lens. Rather go from the inside out like this, following this side like this, and not circular. To insert a contact lens, a safe way to do it is by using your right hand, starting with my right eye, of course. So grab the top part of your eyelid like this, the bottom part with your middle finger of the left hand, and then just placing the contact lens there. If you find yourself that after you've put your contact lens in that you're having any itchiness, any discomfort, then it might be that you have put the contact lens the wrong way. So the way we check to see if a contact lens is inverted is by placing it in your index finger, and you can either hold it up to your eye, see if the edge is flaring out instead of having a bowl movement, or if you gently push the edges of the contact lens together like a taco and you see that the edges are touching, then it is the correct way. If it's flaring out, then the lens is probably inverted. Some lenses have visual markings. They have numbers like 1, 2, 3. So of course, if the number is backwards, then the contact lens is not the correct way. The way that we remove the contact lens is, I like to just grab. You can pinch the contact lens out, or if you're finding a hard time removing it, then just simply go like this and then push it out, blink, and it would pop out. So the wearing schedule of contact lenses varies according to what you have. Some contacts are made for extended wear where you can use them for a month. Some contacts are made to be worn in the morning and in the night for an extended time, and some are just made for daily wear. So the important part, even with daily wears, even if it's daily wear or extended wear, is to remove them at some point in the day to allow your cornea to get some oxygen, and so that the eye does not get any type of edema, any flaring with the blood vessels. So like I mentioned, Biotrue is a very good brand for a very good solution for you to have at home, and you can also use this one to put inside the case when you're storing it. The case typically comes good for a month. So after a month, it's good for you to go ahead and throw it, because it can have any dirt or anything like that can get in your eye and affect your vision. Every 7 days, it's good for you to get it, wash it with a little bit of soap and water, make sure you rinse it, let it air dry. Every day after, when you put on your contacts, then you can go ahead and give it a quick rinse and maybe put it dry so it can get rid of any dirt that may be inside. And if you feel any itchiness, any discomfort, and you've already removed your eye to see if it's inverted, but you're still having problems, when you put your glasses on, you're having problems with adjusting your vision, or if you see any redness, anything that concerns you, then it's very good for you to go ahead, remove your glasses, and maybe visit your provider. And that is also, the wearing schedule of the contacts is also a very good reason why we should have a second pair you know, a backup plan like glasses. I know sometimes we are used to with having such a perfect vision with soft contact lenses that we do not want to wear glasses, because it's easier just to move your eyes and be able to see your sides, and in the glasses you have to turn your head. However, for the health of your eye, it is best for you to have a second pair of glasses, just for you to pop on maybe the last 3 hours of the day, the last 4 hours of the day, and just let your eyes rest. Do you have any questions? If not, then that'll be all.